If you or someone you care about has ever gone through a kidney stone, you already know just how painful and frankly how scary it can be. Well, in this explainer, we're going to demystify the whole thing. What a kidney stone actually is, how you get through it, and maybe most importantly, how to keep it from ever happening again. Let's jump in. So, first things first, what exactly is a kidney stone? We've all heard the term, but the name itself is a little bit of a misnomer. The stone, which is really just a hard little clump of minerals and salts, isn't actually the problem when it's just hanging out in your kidney. The real trouble kicks in when it decides to go on a journey. Honestly, the absolute best way to think about a kidney stone episode is to just see it for what it is. A plumbing problem. That's it. Your urinary tract is basically a series of pipes, and the kidney stone is just a clog. If you can hang on to that one simple idea, it makes the whole experience so much less frightening. And this slide right here, this explains exactly why it hurts so much. See, the pipe that runs from your kidney down to your bladder, it's called the ureter, is incredibly narrow. So when a stone gets stuck in there, urine can't get through. It backs up, causing the kidney to swell up like a water balloon. That intense pressure is what your brain feels as that overwhelming pain we call renal colic. Okay, so that's the mechanics of it, but what does it actually feel like when you're going through it? Let's break down the 4 key symptoms of this plumbing problem. For most people, the very first sign is this super specific, sharp pain. This is not a dull, general backache. It's a really targeted, cramping feeling deep in your flank, right there on your side, just below the rib cage. That's basically your body's alarm bell, telling you the stone has officially left the kidney and started its trip down that tiny ureter. And this explains why it's called renal colic. The ureter is a muscle, and it's physically trying to squeeze and push that stone along. These contractions are what create these just excruciating waves of pain that feel totally unbearable. But then they're followed by moments where it calms down a bit, right before the next wave hits. Now, this is going to sound strange, but this can actually be a good sign. It means the stone is making progress. As that little stone travels down the ureter, the spot where you feel the most intense pain actually moves with it. It shifts from your back and side down toward your groin. It's like a painful little roadmap of the stone's journey. And finally, as the stone gets really close to the bladder, it starts to irritate that whole lower part of your system. This is what gives you that feeling like you have to urinate all the time. You might also see some pink or even red in your urine, and that's usually just because the stone is physically scraping the delicate lining of the ureter on its way down. Okay, so you're feeling these symptoms, you get to the hospital, what happens next? Well, the medical team's #1 job is to confirm that it is a stone and then figure out exactly how big it is and where it's located. Here's how they do that. Doctors really have 2 main tools in their toolbox here. The non-contrast CT scan is the gold standard. It's like the super detective that can find even the tiniest stone and give you its exact size and location. The KUB X-ray, on the other hand, is more like a simple tracker. It's often used later on to just check and see if a stone they already know about is successfully moving down the pipe like it's supposed to. Right, so once that stone is found and they know its measurements, the path to feeling better gets a whole lot clearer. And believe it or not, it pretty much all comes down to one critical thing: the size of that stone. This is the big question that shapes your whole treatment plan. Is the stone small enough that your body can pass it on its own, maybe with a little help? Or is it just too big to make it through that pipe, meaning we need to go in and get it? If the stone is small, we're talking usually under 5 millimeters, the game plan is to help your body do what it does best. That means 2 things. First, hydration. You'll be asked to drink a ton of water to create a really strong flush to push things along. And second, doctors will often prescribe a medication called tamsulosin. Its only job is to relax the muscular walls of that ureter pipe, basically making it a little wider so the stone can slide through more easily. But if the stone's too big or it just gets stuck, that's when a urologist steps in. One common option is shockwave lithotripsy. They use high-energy sound waves from outside your body to blast the stone into tiny sand-like bits that you can then pass easily. The other main procedure is a ureteroscopy. This is where a surgeon literally guides a tiny little scope up the ureter to see the stone directly. From there, they can either grab it with a tiny basket or just use a laser to break it up on the spot. All right, let's talk about what is arguably the most important part of this entire experience: getting through the pain and the intense anxiety that comes with it. The pain can be so severe that it makes you feel like something is terribly wrong, but it is so important to understand what's really going on. This right here, this is the single most important message of hope you need to hear. Remember our plumbing analogy? The pain is all from the blockage, from that pressure building up. The second that stone pops out of that narrow ureter and into the wide open space of your bladder, the blockage is gone. The pressure is released, and that crisis-level pain just turns off, like flipping a light switch. So here's the bottom line. You have to remind yourself, this is a temporary mechanical problem. You are not breaking. It's just a clog in a pipe. The pain, as intense as it is, has a definite endpoint. And you should know that modern IV anti-inflammatory medicines are incredibly good at calming those ureter spasms and giving you some real relief while you wait for that stone to pass. Okay, you made it. The stone is out, the pain is gone. Now the mission changes completely. The new focus is making sure this never, ever happens again. Let's talk about the proactive plan for prevention. Your action plan is built on 3 really simple but powerful pillars. The absolute foundation is goal number 1, hydration. The idea is to drink enough water, we're often talking 2 to 3 liters a day, to keep your urine really diluted. That makes it harder for those mineral crystals to find each other in the first place. Then we have goal number 2, dietary citrate, and goal number 3, stone analysis. So let's look at that second goal, dietary citrate. A lot of people call this the lemonade trick, and it's a fantastic stone inhibitor. Citrate is a natural compound you find in lemons and limes, and what it does is it essentially coats those little mineral crystals in your urine, making them slippery so they can't clump together and form a bigger stone. Just adding some fresh lemon juice to your water every day is one of the easiest prevention strategies out there. And finally, we have the most important piece of the prevention puzzle, actually analyzing the stone. You know when doctors ask you to strain your urine and try to catch the stone? It's for a very good reason. Knowing what that stone is made of is the key. Is it calcium oxalate? Is it uric acid? Getting it analyzed gives you a blueprint, which allows your doctor to create a personalized diet plan to help you avoid the specific things that are causing you to form stones. So look, there's no denying that a kidney stone is a really painful event, but it doesn't have to be just a crisis. By understanding it for what it is, a simple plumbing problem, you can get through the moment with so much less fear. And, more importantly, you can use the information you gain from it to build a proactive plan that puts you right back in control of your health.